So, good morning, everybody. And again, to our essential employees out there, thank you for what you're doing every day to keep us safe, keep us moving in the right direction. To everyone out there doing the right stuff. And it is reflecting so far in our data, so which is good. So, as of today, we have 1,805 positive cases of the coronavirus, up 6 from yesterday. 542 people under mandatory quarantine. So, which is also good. 6 people under precautionary quarantine. As of today, we have 5,000 people that have completed quarantine, and we have 1,526 tested positive for the virus have recovered, which is 44 new recoveries today. So, which is also good news. Our hospitalization rate is 0.77%. It's up a little bit from yesterday. Yesterday it was at 7.2. That went up a little bit. We have one person in our ICU. It's the same as yesterday. And we are up 14 people that are hospitalized right now. That's up 1 from yesterday. So we slightly went up since Saturday, too, since then, which is a little bit of a change. Over the last 5 days, there's been an average of 6.5 new positive cases. And yesterday it was 9, so that went down, which is also good. As I say, I continue to urge people to get tested, to go to our mobile sites to get tested, to go to the Rite Aid on Central Avenue, to go to Albany, to Sethq for the essential workers, the drive-through for everyone else. It's there, it's available, it's free, and we encourage you to go out and get tested. Also, I want to remind people we have the free walk-up testing site at 20 Warren Street, and that will be June 10th from 9 a.m. to 11. The 78 protesters that we did on Thursday, we still haven't got their numbers back, so I know Liza probably wants to talk about that too. We've been watching the protests, we've been watching the numbers, and we're seeing if it spikes up, because that's going to affect us going into phase 3 on the 17th of June. That's going to affect us going forward if them numbers spike up and they go in a different direction. But we have not seen that yet, and I encourage everyone out there that went to the protest in Troy that lives in Albany County, to any of the protesters who have been out, please, by all means, come to our testing sites. All you have to do is show an ID. If you have insurance, great. If you don't, we pay for it. So, and also the standing order stands for police officers and EMS and first responders, to DGS workers, everyone that's out there keeping us safe through this and setting up stuff. We made that available for you. We'll come to you. We'll come to the police station if need be. Also, we set up other hotlines for police officers and everyone else that they can call to address any issues that they may have through these difficult times that we're all having. So please keep that in mind. You know, again, as we're getting closer to phase 3, we still do the control room meetings every day at 1400 hours to find out what's going on, and we continue to look at our stats and different questions. One of the things I did bring up, besides nail salons opening up, which has been a huge question, we've gotten the question from graduation for high school seniors. I know that's where Dr. Whalen's going today, that big smile because she's proud of her son. You know, we have high school graduations that we do want to go out. I can't answer that. I brought that question. I said, you know, I've talked to a variety of superintendents. They have great guidance what they want to do for either the drive-ins or the virtual drive-bys. I said I saw that happen in Voorheesville for Matty Jones and other people, and I know Voorheesville wants to do another one. I know the guidance came out 150. Where that number came from, it's just a number they gave us. So I know there was 11,000 people protesting in Troy, and it was peacefully done. It was well done. And if you can have that, why can't you get back to graduations? I don't know. But I do know the answer because of the, sorry, I shouldn't say it that way. It's what Dr. Whalen and I have been preaching for the last, I think, 89 days, that social distancing is working. It is helping us keep that number down and beat the curve. So we know why, but it's hard to explain to parents and everyone else why you can do one thing and can't do the other. So I'll continue to try to get guidance on that from the control room. But the percentage of those who have tested that come back positive continued to decline. The percent of positive rates dropped from 8.3% to 6.3%. Between those states, we've also tested nearly 10,000 people. So far altogether, we tested 32,194 people here in Albany County. We also discussed how the coronavirus is having a greater impact on people of color. Sadly, we continue to see African Americans making up far too high a percentage of those hospitalized and sent into the ICU compared to the data that we've been receiving. So the death rates don't show it, but the hospitalization rates do show it for African Americans that are in the hospital more, in ICU more, because of underlying health issues, and it's something that we have identified and we need to continue to work on long after this is over with. However, we're seeing some progress in the breakdown of deaths. May 17th, African Americans made up 17.6% of all deaths in Albany County. As of June 7th, that has fallen to 13%. According to the 2018 U.S. Census estimates, African Americans make up about 11.4% of Albany County's population. So I'm going to go to the smart board before I turn it over to Dr. Whalen. And I just, a couple things, and I know she'll point out other things, but it's the one thing I've been harping on since the beginning. The 20 to 29-year-olds versus the 50 to 59-year-olds, and then you look at the other things. That 20 to 29-year-old, and to the parents that said, yes, I'm just scaring their kids, yes, I was trying to scare them, because they're the ones, and Dr. Whalen can say it better than I, that have no underlying health issues, that show no signs and symptoms, but are out in the community because they feel, well, I'm not sick, I'm young, I'm going to get out. Well, now look at your number. You're well past the 50 to 59-year-olds, which we talked about, and that was the highest number we had up until about a week ago or 2 weeks ago. Then it changed, and that number continues to grow, and that's the number that I've stayed fixated on because of the spread. And it's going to freeze up now. There you go. It's me. It's a challenge, little fingers, right? So again, as I said, all total persons tested 32,194, and that's a percentage result of 6.10%, and persons tested today was about 1,100. So which is good, new positive cases, which is always different, and I'll let Dr. Whalen take it from there if you like.
Thank you, County Executive McCoy. So there's a couple of additional points that I want to highlight in this data. And first of all, we always look at this curve, which is the Epi Curve. That lets us know over time. All of these numbers you can't see along the bottom from where you are, but this goes from March 12th, right around when we had our first case, up till June 8th. And you see, if you make a line of best fit going across this, that we peaked right around the 22nd of April. We had our highest number of cases. The number of cases went up and the number of cases started to come down. We are really seeing those numbers drop off, and this is certainly encouraging. We've gone through the zip code data every time we've presented this data, and it's fairly consistent that we still see our highest numbers in 12203. As the county executive indicated, this is the first time that we see the age 20 to 29 group become pull ahead of the 50 to 59. So I'll talk a little bit more about the importance of this when I finish the slides. And I think that the data, when we look at the available racial and ethnicity data that we have in Albany County, continues to show a disproportionate number of hospitalizations and ICU hospitalizations in our African American population. As I discussed previously, we have reached out to the community. We've tried to learn some more about possible barriers to testing, and we're trying to address those within the community. And one thing that we also heard was that people weren't being tested unless or until they became more severely ill. So we want to again reiterate the importance of early testing, which is important not only for your own medical care, but to protect your family and those around you. I think this number is a great number. To have tested 32,000 residents in Albany County is a real accomplishment on our part. And, as the county executive indicated, the numbers do show that we are trending down in terms of positive results. The governor put up a slide yesterday and indicated that at the highest point of testing, about 14% of tests in the capital region, this is beyond just Albany County, were positive. And now this total number of positive in the capital region is around the 1 to 2%. So we are seeing the percentage of tests that come back positive go down, which again is encouraging. If we look at the numbers for testing, which is another number that I always look at, because, you know, if you're not testing that many people and not getting that many positives, it doesn't tell you the same story as if you're doing a ton of testing and not getting a lot of positives. As you see, our numbers of tests per day in Albany County are pretty good. We're still testing, about 1,200 people on June 8th, and the percentage positive continue to go into very low numbers. So I think on the whole, the data that we see between our data and the COVID tracker for the New York State Department of Health is encouraging. And that's good news. What I would stress and want to reiterate is that it is not we are out of the woods news. So we have seen, as we have watched other countries reopen, that there's almost always a spike. And this is something we're tracking on a daily basis and being very careful. We have seen that there is a difference in areas that are vigilant in their reopening and areas that are not. So what does that mean? That means that as we open up, as we start to have more of the ability to freely circulate, to enter into public places, to dine outside in restaurants and to do other things, it is more important than ever to utilize the community mitigation type efforts, the efforts of social distancing. And again, I want to reiterate, social distancing has three components. It is staying 6 feet away, it is also wearing a mask, and it is also hand hygiene. And all of those three things have to go together for these strategies to work. So we encourage the community throughout the county to continue to utilize these important measures as you spend more time out and about. And we will continue to follow the numbers along. At this point, we're 2 weeks out of Memorial Day. We're about a week, and we are having ongoing mass gatherings with protests. We are still encouraging people that attend mass gatherings to be tested. And again, remember, if you're wearing a mask, you're protecting yourself. But if somebody next to you is not wearing a mask, you are not completely protected. So I've had people say to me, "Well, I went to a demonstration, but I wore a mask. I went to a protest, but I wore a mask." Well, you did a good job protecting others, but that doesn't mean that you were completely protected yourself. So we do continue to encourage people to get tests. I wanted to just bring up something else, which was some information that emerged from the World Health Organization yesterday. This talked about asymptomatic spread of coronavirus. And as you know, our talking points on this, as we have evolved with information over time, have changed. So originally, we said people that are asymptomatic are not likely to transmit infection. And then we said people that are asymptomatic can transmit infection, so people should be aware of that as a control measure. The new data, and again, the data is as good as the information that we have been able to analyze. So as we get more analysis of data, and that comes from very rigorous contact tracing and disease investigation, the information that they are now sharing with us, and I want to be careful in how I relay this, because to me it's a difference, but it's not a big difference in terms of how you act. They're talking about people with very mild asymptomatic disease. So they call this symptomatic, so there's a paucity of symptoms. And we know that there are those that have positive tests that may say, well, I had something like a cold, or I had a sore throat for a couple days. I never had fever, and then I was fine. And again, that's that younger age group. The data is now suggesting that those people who have that kind of an infection are not a high risk to transmit infection to others. So where's the catch? The catch is that many people who are asymptomatic go on to develop symptoms. So having no symptoms and a course of disease where you don't have symptoms is a different thing from having no symptoms and then testing positive and then going on to get sick. So in that latter group of individuals, they are asymptomatic, but they are now thought of as pre-symptomatic. Those individuals are thought to shed disease 2 to 3 days before they develop symptoms. So as you see, in both these circumstances, we're talking about individuals that would be asymptomatic. In one group, these individuals don't go develop symptoms and they're not likely to transmit infection. In the second group, they do go on to get symptoms and go on to develop illness, which may range from a flu-like illness to a more severe illness where they require hospitalization. In those cases, they are more likely to transmit before they develop symptoms. So for the general public, I think the information is that you need to protect yourself and your family regardless, because obviously you can't tell the difference between who is pre-symptomatic and who is going to develop asymptomatic disease. So this is an important consideration in terms of the information that's coming out today, and I am certain that this will not be the end of this discussion. As data comes out, as we are able to analyze more in the county, in the state, in the country, and throughout the world, we're developing more sophisticated knowledge of how the virus spreads. And as that knowledge becomes apparent, that's something that we will be sharing with everybody as time goes on. So that's all the information I have. I just want to give a shout out to the class of 2020. I think that this group of young people across the county has done a wonderful job of accepting civic responsibility. This is a challenge that hasn't occurred to many of their peers. It hasn't occurred in years. And I do have a son who's a senior in high school, and I've seen through his friends and the wider group that we've gotten feedback on over time that this group is really concerned, and they are learning a lesson from this. And I think this is a lesson that will probably, despite the challenges that they faced this year, despite not having their last few months of senior year, despite not having their proms and their graduations, their large graduations, it will stay with them and it will benefit them and it will teach them over time. So I want to congratulate them all and for the great job that they've done and the wonderful accomplishment of whether they're finishing high school or college or another degree. Congratulations.
Congratulations to your son, and you see the parent side coming out, which is nice. And thank you for that update, Liza, as always. We did get some guidance, even though we are in phase 2 on parks and recreation, different things. We did say sometimes it's slow coming out. But parks and other open public spaces, except playgrounds, can be opened where, obviously you're socially distancing and all that other stuff. Non-motorized boats, which we all knew about, rentals such as rowboats, kayaks, and canoes are okay. Golf courses and driving ranges are a go. Miniature golf, which is up my alley. I don't know about anyone else out there. No miniature golf right now. I don't understand that one, but what are you going to do? I don't have time for it anyway. So food and retail services subject to restrictions are currently in effect in the region. Racket games such as badminton and pickleball and everything else is good to go. Bowling games such as horseshoes and a bunch of bing bag toss, cornhole and all that's good to go. So we have a variety of that and different things. So you can go online and see all that. Obviously we know about the drive-in movie theaters, marinas and boat yards and recreation marinas, manufacturers for ongoing marine operations and boat repair, maintenance and such facilities are a go, but social distancing and sanitation protocols, that type of stuff. Phase 3. Hopefully it starts June 17th. Hopefully phase 3, and we're pushing for it, that we get into it a little bit earlier. But personal care services, which include the favorite question I'm getting, nail salons. Yes, Steve McLaughlin, you'll get your nails done on Wednesday the 17th. We'll make sure you got the first appointment. Tattoos and spas get to open up on the 17th. So, you know, that's going to happen, which is good. And they already know. So the good thing is the guidance is out. A lot of the companies or a lot of the restaurants, and the feedback we got was that the guidance, you know, the day before they announced that they could open up to outdoor recreation, or I'm sorry, not recreation, as you were, to dining, that basically they weren't ready. Some restaurants weren't ready. So this is good stuff we're putting out now. It gives people plenty of time to get ready, and I think everyone is ready to open up and get back to some type of normalcy. So please go to our website and look at that. There's more stuff to talk about. But again, you have to maintain the 6 feet. You have to fill out that certificate. Go to the state dashboard. Please fill that out. Take care of that. Educate your employees so they can educate the public as they come in, your consumers, and make sure everyone's taking care of everyone. And we're going to get through this. So we have to make sure that you do that. And let's see, the other thing was wear face coverings anytime, you know, you're dealing with consumers, performing service, ring up purchases, wrapping items, handoff. They have that down too. So that's one thing that they have to deal with. And obviously, pretty much if you see a lot of businesses already have the plastic glass up and all that other stuff up. So they're ready. They're ready. So we're ready for phase 3. The numbers are looking good, and as long as we continue in this direction, it's going to be good stuff going forward. Yesterday, I issued our team challenge with Albany County Stay Safe, hashtag Albany County Stay Safe, in partnership with PAL, great organization in AT&T. I've said this time and time again, simply because we're reopened doesn't mean we're going back to business as usual. And the social media challenge is a fun way to send the message to 13 to 18-year-olds. And I had to remind my 15-year-old she can't win. So, and yes, I'm becoming her guinea pig, wearing her stuff that now she's making me wear as I go forward. So, but she can't win. And to demonstrate how they're staying productive, also social distances, avoid large crowds, and wear masks. So we look forward to that. The week 4 challenge shows how you're saving our planet by recycling, how you're recycling in many new ways, and doing it safely about recycling. So please post a photo or video to Instagram with the hashtag at Albany County Stay Safe by Saturday, June 13th at 11:59. Winners will be randomly picked to win a $25 gift card, so which is all good stuff. Also, I want to thank the 2 winners from last week. So great job in winning, and also I want to say this, as always, our mental health is available for everybody, 7 days a week, in 8 a.m. to 8 p.m. They're there for you. They're there for anyone with any question that you may have, especially as we continue to open up and get out there. And the uncertainty going on, not just with the coronavirus, with everything else changing in the world and going on with all the issues, please feel free to call. That's what we're there for. Area code 518-269-6634. As always, our 24-hour sexual hotline number, area code 518-447-7716. And our United Way number, 211, in the New York State hotline. As always, please continue to do what's right. Stay safe. Wear your mask. That's what I liked about with all the protests. I saw probably 90%, if not 99%, wearing masks. So thank you for that.